अगली खबर का रुख कर लेते हैं। ये बड़ी खबर इस वक्त की आपको बता रहे हैं, जहां राज्यसभा में सांसद कार्तिकेय शर्मा का सवाल। प्राइवेट अस्पतालों की लापरवाही पर सवाल पूछा गया। बिल नहीं चुकाने पर शव देने से मना करते हैं। इस तरह की घटनाएं दुखद, असंवेदनशील। कार्तिकेय शर्मा की ओर से बयान दिया गया है। आर्थिक तौर पर कमजोर लोगों को दिक्कत होती है। राज्यसभा सांसद कार्तिकेय शर्मा की ओर से ये बयान दिया गया। उन्होंने इस तरह की घटना को निंदनीय और असंवेदनशील बताया है।
Thank you, Chairman sir, for giving me an opportunity to speak on this important issue, which is concern over refusal by hospitals to release dead bodies due to pending bills. There are umpteen saddening stories narrating the insensitive instances of refusal by a hospital to release the dead body of the family due to outstanding bills. The grieved families, already traumatized with the loss, are subjected to further distress for immediate commercial recovery. A report by the Lancet Commission on the value of death published in the year 2022 states that in situation where a family is unable to pay hospital medical bills, hospital staff will often refuse to release the body of the deceased until the payment is made. The Geneva Convention and the UN Commission on Human Rights make it legally binding, provide for explicit provisions relating to the proper management, dignified treatment and disposal of dead bodies, as well as respect for the need of families. So earlier, answering to my question, the Honourable Minister informed the House that there is no such legal provision authorizing any hospital to withhold dead bodies in the lieu of pending bills. Therefore, I urge this august House to deliberate on the situation that will bring some relief to the mourning families. I also request the Minister concerned to evaluate and issue guidelines for immediate release of the dead bodies and subsequent period for clearing the dues. Suggestively, penalties for the defaulting hospitals and that violate the said guidelines should also be incorporated for ensuring strict compliance. There is a growing consensus at international level that all patients must enjoy certain basic rights. In other words, the patient is entitled to a certain amount of protection to be ensured by physicians, healthcare providers and the state, which have been codified in the various societies and countries in the form of charters of patients' rights. The patient rights charters, as approved by the National Council of Clinical Establishments, is available in public domain and needs to be promoted in good spirit. Further, we can collectively implement a few steps. Spread awareness about the Patients' Rights Charter and the rights that families of the deceased have in such situations. The Patient Rights Charter enlists 17 rights of patients, including the right to information, whereby every patient has a right to adequate relevant information about the disease, right to record in reports, the right to emergency medical care, the right to informed consent, the right to confidentiality, the right to second opinion, the right to discharge of patients or receive the body of deceased from the hospital and more. Enforce hospitals to display the charter in important areas of the hospital so that accountability is held. Treat violation of the charter with firm laws, as non-release of dead bodies is treated akin to violations of habeas corpus. Create a national helpline to assist the mourning families in such unfortunate times, and create a national corpus fund. So, and more importantly, let's incentivize the hospitals and doctors to a community so that they encourage and follow the Patient Rights Charter. Thank you very much, sir.